When we're doing retirement planning for clients, individuals are often surprised to find out the magnitude of expenses each year that we have to factor in to cover their healthcare costs. During the working years, people are just used to paying out of their paycheck a certain amount every pay period, but those costs can actually be substantially higher as soon as someone enters the retirement years. If they're retired before 65, they might be looking at exchange coverage or COBRA coverage. 65 or older, there's actually a cost associated with Medicare for Part B, Part D. Then you have to get a supplemental Advantage plan, which could be additional monthly costs. Prescription drug coverage has gone up substantially over the last few years. And then we get into, okay, what are we going to do if there's a long-term care cost down the road? How are we going to budget for that expense? Hello, everyone. I am Michael Ruger. I am the managing partner of Greenbush Financial Group. Where we're going to start this healthcare cost journey is understanding that retirees fall into one of two categories. Category number one are the retirees that retire before age 65, before Medicare coverage begins, and those that retire age 65 and after, that go right from their employer health coverage directly into Medicare. So we're going to start off by talking about the retirees that go before 65, and there's two categories of those. The ones that have some form of retiree health coverage through their employer, even though there's less and less of those, and those that do not have retiree health coverage through their employer, and they have to go directly into an exchange policy or COBRA coverage. So for the retirees that retire before age 65, that have some form of employer health insurance coverage, we still have to ask a number of cost questions. Question number one is, does that just cover the employee, or does it cover the employee and their spouse if they're married? The second question is, what portion of the premiums does the employer continue to pay? And is there going to be any out-of-pocket costs for the retiree after they've left the employer? And number three, what are the out-of-pocket costs associated with the retiree coverage, deductibles, co-pays, co-insurance, etc.? And then we have the other category of those that retire before age 65 that have no retiree health coverage, that are usually looking to access either COBRA coverage through their former employer or an ACA or exchange plan through their state. Now, COBRA coverage can be a viable option, might cover an employee up to 18 months after they've left that employer, but it can be extremely costly because when you're an employee, you were just paying the employee portion. A lot of times the employer was picking up a big chunk of that cost. When you go under coverage, you have to pay the full thing. These higher costs can then cause these new retirees to evaluate the exchange policy options through their state, which oftentimes have income subsidies. It's not uncommon that when someone retires, their income's going to drop, so they could get really good health insurance coverage through the exchange at a minimal cost. It's also important to understand these exchange plans, they're just looking at income. They are not looking at assets. So we've had clients that have retired with over $1 million that are actually showing very little income that can get their health insurance for a very nominal cost. Now, a word of warning when assessing whether to go with COBRA coverage or exchange coverage. While the exchange coverage might be much cheaper from a monthly premium standpoint, you have to look at your personal situation to say, what are going to be my out-of-pocket costs, COBRA versus exchange? We've had clients that have retired that had very specialty pharmaceutical drugs that under their COBRA coverage to the employer had a lot less out-of-pocket costs, or if they went to the exchange plan, yes, the premium was lower, but it was a specialty drug, so their out-of-pocket costs would have been thousands of dollars per month. So that covers all the pre-age 65 healthcare costs. Now let's talk about 65 and after once Medicare is kicked in. So people are surprised to find out there is monthly costs associated with Medicare coverage. Even though you paid taxes in the system all these years, once you get there, they will deduct the monthly premium typically for Medicare Part B and Medicare Part D. So A is hospitalization, that's free. B is most of the doctor visits, and D is the pharmaceutical piece. In 2025, the base premium for Medicare Part B coverage is about $185 per month per person, and the average Part D prescription drug coverage is about $36 per month. So when you total those two up, it's about $220 per month per person. So if you have a single person, they're paying about $2,400 per month. If you have a married couple, they're paying about $4,800 per month just for basic Medicare coverage. But then retirees find out that basic Medicare coverage by itself usually isn't enough, which is why then retirees have to go purchase either a Medicare supplemental or a Medicare Advantage plan, which fills in the coverage gaps that Medicare does not cover. And many of these supplemental and Advantage plans have either monthly premiums associated with them, there's co-payments, there could be co-insurance, but they vary greatly depending on what plan you choose to go with. The next big cost that retirees can face, which is kind of wrapped into this Medicare healthcare cost decision, is pharmaceutical drug coverage, which the cost of these pharmaceuticals has gone up substantially for the last 5 or 10 years. And depending on what pharmaceutical drug someone is on, there's tier 1, tier 2, and tier 3. So tier 1 drugs are generic. Those tend to be the cheapest. Tier 2 are kind of the brand name ones, and tier 3 are the specialty drugs, which are typically the most expensive. So now when we look to total up the annual cost that's expected for each retiree, we're looking at their Medicare Part B and Part D premiums. Is there any monthly premium or cost associated with their Medicare Advantage, Medicare Supplemental plan? And is there anything pharmaceutical-wise that they might have a specialty drug or tier 2 drug that's going to cost them more out of pocket? A special note with pharmaceutical drug coverage. So some states have special programs to help retirees supplement some of the costs associated with a prescription drug. Like in New York State, we have the EPIC program, where as long as the income level of retirees is under a certain amount, they can roll in the program, which could help subsidize some of the cost of the prescription drugs that they're now paying out of pocket. Now, after all that, we still have to address the risk and cost of a potential long-term care event down the road. So people are also surprised to find out that Medicare provides very limited coverage when we talk about long-term care events, assisted living, nursing home coverage. There's a very small window of coverage it provides, but once people get outside of that window, the cost can be $120,000 plus per year for that type of coverage. And as planners, we're seeing more and more individuals need this type of long-term care because of longevity. People are living into their 80s and 90s more frequently, and they need more care in those later years. And there's 3 ways that typically people pay for that care. So it's either they get a long-term care policy, which can be expensive. They are self-insuring, which means they have enough assets set aside to pay privately, which you need a good sized pool of assets to do that, or they're doing the Medicaid trust, which is they're trying to protect their assets from a Medicaid spend down process, and then Medicaid picks up the tab if there's a long-term care event. But the key thing for any of those 3 strategies to work is a lot of planning has to be done proactively well in advance of a long-term care event taking place. If families wait and then a long-term care event occurs, the options are very limited, and they might end up in that ugly spend down process where they just spend down all their assets and then eventually qualify for Medicaid. It's because of all these things that it's worth taking the time to really quantify all these healthcare costs before you actually retire, to make sure they are baked into your annual expenses so there are no surprises in the retirement years. I hope this information was helpful. If you have any questions, please feel free to reach out to me at greenbushfinancial.com. Thank you.